Welcome to Full Circle. I'm Suzanne McAllister. Well, I have a question for you. Did you get a good night's rest last night? Well, if you did not, be sure and stay right there because our guest on today's program will give us helpful information so that you could perhaps get a good night's rest tonight. It's my pleasure to welcome Dr. Mohamed Heikal to the program. He is a pulmonologist and he is with the St. Vincent Medical Group. It is wonderful to have you here.
It's wonderful to be here. Thank you for inviting me.
Thank you. And doctor, tell me what a pulmonologist does.
So a pulmonologist is a person who takes care of breathing, somebody who attended medical school and had enough training afterwards to take care of seriously ill people in the intensive care unit, as well as taking care of serious problems as an outpatient as well. So these problems can range from chronic obstructive pulmonary disease, breathing problems, those kind of problems.
So let's talk about sleeping specifically because there are so many things we hear about. Narcolepsy, insomnia, sleep apnea. Give us a framework on how that all fits together and how you interact in those situations.
Sure. So talking about breathing, of course, all of us breathe overnight as well. And we need to have good amount of sleep at night as well to be able to function well during the day. If we lack adequate breathing at night, then that affects the whole body. If we are not breathing well at night, then that affects the heart, affects our blood vessels, affects our attentiveness during the day, and therefore it can be very closely related to how our body functions during the night and during the day as well.
So let's go back to what you were saying about having a good night's rest. As we get older, sometimes I've heard that we don't need as much sleep. Is that a myth or a fact?
Well, it's not completely a fact. It's how our body evolves over the years is what dictates how much we need. However, it is a fact that normally sleep, as sleep stages go overnight, get affected by our age. So for example, people when they get older, they may have lesser amount of deeper sleep at night, and that can be part of how normal sleep can be. However, that has to be differentiated from having really problem maintaining sleep and adequate sleep overnight. So rarely that people have normal pattern of sleep or normal components of sleep would have symptoms from it. So if you do have symptoms, the odds are that there is a problem.
So if you're getting up and having, legs kicking and not sleeping through the night, obviously we need to seek the help of a pulmonologist.
Sure, absolutely. It's actually seeking the help of sleep physician. So like what I said earlier, the pulmonary is related to sleep in terms of the upper airways, in terms of the respiratory status at night, and that's very closely related to sleep, so I'm a sleep physician as well because of that.
Okay, so one of the big things we hear about is insomnia. Mm-hmm. Tell me a little bit about that.
Sure. So if somebody sleeps at night and have no problem falling asleep, have no problem maintaining his or her sleep, and then functions well at night, during the day, then that person most likely don't have any problem. However, if somebody has difficulty falling asleep or maintaining a sleep or having the adequate time of sleep at night, like for example, every 6 or 8 hours of sleep, and then having manifestations during the day, that's what insomnia is. That can happen over a short period of time or a long period of time. If it's a short period of time, that's what they call acute insomnia. And many times those people would not need a specific treatment. Most likely it's related to an event to their life or something like that. But the chronic insomnia most of the time is what people refer to as insomnia.
So how is that treated?
It depends on what caused the insomnia to start with. There are many types of insomnia that we can evaluate for in the clinic, and depending on what kind of insomnia we have, then we can offer specific treatments for. Some of those treatments can be related to actually helping the individual restructure their sleep to fit what their life cycle is and what their wakefulness and nighttime is. And sometimes can be related to help with certain medical conditions that might help them to sleep better at night. And one of them is, the obstructive sleep apnea that we talked about earlier too.
Sure. You talked about going into the clinic. I've heard of people that go in and they have to rest throughout the night, and you actually monitor their sleep-wake cycle.
Right.
How is that helpful for you as a physician to get a sense of what the patient's going through and perhaps what their needs are?
Sure. It's a very interesting point because sometimes it's helpful to do that by what the person himself or herself feel, and sometimes it helps to monitor that kind of independently. So we have different ways of having an evaluation or a monitoring of how the sleep cycle is. So a sleep diary, for example, is something that the patient himself or herself reports, and that would be their impression of their night's sleep over days and probably weeks. But also we have a machine that can report that as well. It's like a watch that can report when the patient is awake, when they are asleep, and how frequent they nap, those kind of things. So there are disorders that can affect the person's wakefulness. It can be what they call circadian rhythm disorder, where their internal clock is not working well. So that can drift their wakefulness or drift their sleepiness in a certain way that make them dysfunctional during the day.
Now, does melatonin affect the individual's reaction to their own circadian rhythm?
Yes. Yeah,
and
it
is
does.
that a helpful tool for people to, medication for people to use over the counter?
So it might be, news to some people that melatonin is a naturally occurring substance, and we have it in our body anyway. It's released from a place called pineal body in our brain. So in a sense, melatonin by itself is something that we do have. Now, whether to take melatonin or not is again subject to what do we have as a problem. So some people would need melatonin, some others would not need melatonin. One of the kind of most common examples of needing melatonin are those people who have jet lag, for example, those people who have to work night shifts, shift workers. They might benefit from adjusting their sleep cycle. So it does have its own place in management, but it really depends what we are managing.
So we really need to know what's causing those restless nights.
Right.
Well, don't go away. We will be back with our guest, Dr. Heikal, after this. Welcome back. We're continuing our conversation about sleep disorders with our guest, Dr. Mohamed Heikal. Doctor, earlier in the program, you talked a little bit about the connection between our upper airways and sleep disorders. Let's expand upon that and why it's so important to understand the connection to restless nights.
Sure. The upper airways is obviously the kind of the conductive media, for breathing. So the upper airways extend from the nose down to here to the vocal box, the cartilage. And they are not made of anything solid. So you have all ligaments and muscles, so they easily can collapse. And normally, all of us, when we sleep at night, we collapse upper airways to a certain degree, very minimal degree. So we shouldn't have any problem breathing at night if just normally, breathing. However, in certain situations where we have more fat in the neck, or if we have more floppy upper airways, then we can start having problems by vibrating the upper airways more than the usual, or collapsing the upper airways more than what they should do.
So if we snore, is that part of a problem then?
It is reflective of more floppiness in the upper airways. So people who snore, which is a pretty common thing to happen, does not necessarily reflect having an actual problem in the upper airways, but it may reflect that you have floppiness in the upper airways to the extent that you have vibrations in the upper airways. And interestingly, people may have sleep apnea, for example, where they have a collapse of the upper airways repeatedly at night with or without actual snoring that could be detectable by somebody who's sleeping with them.
Okay.
So it's important to make the distinction between the two, that we may snore and do have sleep apnea, and we may not snore and do not have and do have sleep apnea.
So could we just simply prop our head up on several pillows and keep our head at a certain angle that perhaps we can not cure, but help overcome that problem? Or is there something more involved that we should be doing?
I think that's a very important question, because the diameter of the upper airway changes with our position. So the diameter of the upper airways are least if you are on your back. So when you sleep on your back, the diameter of the upper airway is actually diminished more. So people will have the tendency to snore more when they are on their back. So if you sleep on your sides, that will be less likely to happen. That's one thing. The second thing, which is also important, is how we flex or extend our neck. So Flexing the neck will be probably narrowing the upper airways more. The other thing is opening the mouth, which is something that may happen frequently with some people with nasal congestion, sinus problems. By the time go, you learn to breathe from your mouth. If you open your mouth and breathe, you are actually narrowing what they call hypopharynx. Hypopharynx is the area here, which is below the mouth. So that area below the mouth decreases in diameter if you open your mouth breathing. So simply by trying to prevent the lower jaw from opening as much, that by itself would improve the upper airway diameter and hopefully would decrease the incidence of snoring, or at least the degree of snoring.
Huh, that's interesting. There's also what's called a CPAP machine.
Yes.
Tell us about this and how it is very helpful.
Sure. So CPAP machines and different brands, different things, different manufacturers have their own machines. All of them go around the idea of providing a pressure that can be hooked up to certain tubing and certain masks, or certain types of interfaces that can go between the mask and the person. And these machines exert continuously a pressure, and that's why they call them CPAP. So it stands for continuous positive airway pressure.
So there's also water in this, doctor. Why is there water there, and there is a mask here that someone would actually put over their face?
Yeah, so if you look at this machine, you have, this part is the actual CPAP, that's the continuous positive airway pressure machine. This part that had the water is basically a humidifier. So that water that you saw there is because of the humidifier need to be filled with distilled water. The other part is the actual CPAP, the machine that delivers the pressure.
And then you have the big tube, and then you have the mask. So tell me how that works and why it's so important to help somebody with sleep apnea.
Sure. So with all this tubing that you see here, eventually the pressure that the machine generates, it gets transferred to the person's upper airways by either one of these or even different masks that you might see in commercially available. But this, for example, is not a mask. It's something that plugs into the nose. They call it nasal swaft, and delivers the pressure directly through the nose rather than through the mouth. The other one, which is a full face, it basically fits on the nose and the mouth and kind of have a seal around it, so the pressure can get transferred into the upper airways through the nose and the mouth.
All right, well, we have a lot to talk about, but we're going to take a break. Don't go away. Well, if you are not getting a good night's rest, you've come to the right place. We're continuing to talk about that subject on today's program. Doctor, I understand that there is a link between sleep disorders and cardiovascular problems. Talk about that, because it's a very serious issue.
It is. It's very important and goes beyond what people feel or manifest with, and that's what makes it even more important. In a sense, when people started first realizing about obstructive sleep apnea or inability to breathe well at night, secondary to upper airway problems, people focused more on their symptoms in terms of inability to sleep well at night, feeling fatigued, tired, dozing off, those kind of things. However, I like to make the analogy between obstructive sleep apnea and diabetes, or high sugar level. In a sense, you may have diabetes all your life and you don't know that till somebody check your blood sugar for you, and then they tell you, well, you know what, you have diabetes. Similarly speaking, people can live their life with obstructive sleep apnea and they don't know anything about it, and they don't realize that they don't breathe well at night till somebody make that call and then say, well, you do have obstructive sleep apnea and you need to treat it. So for sure, symptoms are very important. However, it's very important to realize that at night when we don't sleep well and there's interruption of breathing, the brain takes note of that and it initiates a stress response. That stress response manifests in different ways, but one of these ways of manifestation is having the cardiovascular system, the heart and the blood vessels, act in a different way as like a stress mode. So the heart and the blood vessels go in a stress mode all night long with the events of breathing interruptions occurring, in a sense that every 10 seconds of pausing or stopping or decreasing breathing, then the brain initiates that stress response, increasing the blood pressure, increasing the heart rate, making the blood vessels to squeeze more. So all of that shape up a continuous intermittent stress that people live through at night, night after night, week after week, month after month. And therefore, people who have already heart failure, atrial fibrillation, which is a specific type of irregular heartbeats, or people who have had a stroke, or what they call TIA, transient ischemic attack, or a small stroke, all of these are highly linked to obstructive sleep apnea, and most likely it's because of that stress that keeps happening at night. It's very important to note as well that obstructive sleep apnea is a state that creates inflammation, chronic inflammation in the body, which is kind of an area between the two, area between cardiovascular illness and obstructive sleep apnea. People who have chronic inflammation in general, they are at more risk for coronary artery disease. So all kinds of problems that occur to the blood vessels and the heart can be linked one way or another to obstructive sleep apnea. And therefore, treating obstructive sleep apnea is very important, true for the symptoms, but also true for any other problems that can affect the heart.
So if it's left untreated, you are just having more and more issues with your heart and all of your body.
You'll be missing a very important piece of treating your heart.
So doctor, this is helpful information. If somebody doesn't react to using the CPAP machine that you showed us in the earlier segment, is there surgery as an option?
The word reacting to treatment with CPAP is probably true, but I would kind of try to clarify that issue by one thing, that if I don't feel that I'm getting treated with the CPAP or the machine that treats my breathing at night, it does not always be that way. In other words, 50% of the time, half of the time, that people don't feel any difference when they are on CPAP. Half of the time they do feel the difference in their energy and so forth. So it should not be a discouragement to feel or not to feel, but rather how my breathing would be on the CPAP. However, to go to the other part, which are what are the other things that we can treat our breathing with, the main focus of treatment is to make our breathing steady and smooth at night. So CPAP is still the standard. There are some other things. Surgical interventions could be an alternative. However, many of them are not as optimum to treat the upper airway dysfunction, and therefore they are thought of as a secondary intervention rather than a primary intervention. The most curative, if you will, or the most controlling surgery would be a surgery that will bypass the upper airways and putting a hole in the trachea, and that's what they call tracheotomy, which is a disfigurement by itself. So you might be treating the sleep apnea, but you might be creating another problem. There is a surgery that change the way that the upper airways look like, where they can go in the back of the throat, they cut off parts of the back of the throat and create a bigger diameter. However, that kind of a surgery can be successful only 50% of the time.
Okay, so the message and the takeaway that I have is if you are not getting a good night's rest, reach out to the information up on the screen and you can find out how you can get the services of Dr. Mohamed Heikal, who has been our guest on today's program. Thank you so much. Helpful information. I appreciate your being here today.
Thank you so much. My pleasure.
Thank you. Well, we are back with our music segment after this.
Musical Showcase is brought to you by Flanner & Buchanan, helping families tell the story of their loved one's life. Musical Showcase is brought to you by Flanner & Buchanan, helping families tell the story of their loved one's life.
Well, we are so glad that you could join us today, and we always love our music segment. Kenny Melton is back, and he is going to perform On That Day. Well, I'm Suzanne McAllister on behalf of all of us here at LaCie Broadcasting. Thanks for watching. We'll see you next time.
It was one of those days that seemed so crazy. I guess when it rains, it pours. Without an answer or prayer, or going under so fast, I just couldn't laugh. But back then it seemed a hopeless case, but it brought me to this place. I couldn't believe that maybe God could get me out of this mess. So I confess, then I knew that I'd survive. I never felt so alive. On that day, I could finally rest. On that day, I took a load off at last. On that day, I didn't have to worry anymore. No, Lord, you took me away. Now I'm free. On that day, sometimes I feel so afraid. Sometimes I fall flat on my face. When I'm just too weak to stand, mercy offers its hand, and I'm up again. Then I knew that I'd get through, and it's all because of you. On that day, I could finally rest. On that day, I took a load off at last. On that day, I didn't have to worry anymore. No, Lord, you took me away. Now I'm free. On that day, on that day, I didn't.
Closed captioning provided by Hear Hear. Hear Hear, discreet hearing solutions at affordable prices. 317-731-5386.